Did you know that approximately 10% of the world's population suffers from lower back pain in any given year, which is roughly approximately a whopping 600 million people? Here's another mind-boggling statistic that between 60% to 80% of people will experience back pain at least once in their lifetime. Our lower back, or the lumbar region, is a complex network of bones, muscles, ligaments, and nerves. It supports the entire body and its weight and allows us to move, bend, and twist. In most people, back pain creeps in without warning, turning simple movements into painful reminders that something isn't just right. For many, lower back pain becomes a barrier, stopping us from being our best, keeping us from enjoying life, work, and even the simplest of daily tasks. Hello everyone, this is Dr. Sanjay Arora, and today we will be discussing what causes this annoying pain in the back and how we can tackle it. Now picture this, you bend down to pick up a heavy box or twist to reach something on a high shelf, and suddenly you feel this sharp pain. This is muscle or ligament strain. Your posture could also be your back's best friend or worst enemy. Whether you are sitting at a desk or standing in line, bad posture, like slouching too far forward or leaning far too back, can set the stage for lower back pain. Let's look at another scenario. As you bend down to tie your shoes, a sharp, intense pain shoots through your lower back, leaving you momentarily frozen. You try to stand up, but the discomfort radiates down your leg. It might be your body's way of alerting you to a herniated disc. These discs act as cushions between the vertebrae. When the disc bulges or ruptures, it can press on nerves, leading to pain, numbness, or weakness in the lower back and legs. A common complaint in the elderly as they bend down to pick up their grandchildren in the lower back is a sign of osteoarthritis, a condition that affects the lower back, causing pain from inflammation, degeneration of cartilage, or bone spurs pressing on a nerve nearby. A nerve compression is a condition in which the nerves are pinched or compressed, leading to significant pain and discomfort. This results from a herniated disc or osteoarthritis of the vertebrae. The nerve running from the base of your spine down through your back to your leg is called the sciatic nerve. When this nerve gets irritated, you experience a condition called as sciatica. This pain can range from a dull ache to a sudden electric-like sensation that makes you jump. It often prefers one side, and if you find yourself sitting for long stretches, it might just decide to make itself known even more intensely. Other causes of back pain include skeletal irregularities, which is an abnormal spinal curvature that causes an uneven distribution of body weight, leading to pain. Lack of physical activity leads to weaker muscles, especially in the core and back, which increases the likelihood of back pain. Excessive body weight, especially in the abdominal area, can cause additional strain on the lower back muscles and spine. Stress and anxiety are also known to contribute to muscle tension and exacerbate lower back pain. Jobs that involve heavy lifting, frequent bending, twisting, or long hours of sitting are the maximum contributors to lower back pain. So, how can we break free from this cycle? Prevention is the key. Now, here are some simple yet effective steps you can take to protect your lower back. Start your day with simple stretches to increase flexibility and reduce muscle tension. Regularly strengthening your core and back muscles can also provide better support for your spine. If you're sitting for long periods, take regular breaks to stand, stretch, and walk. Movement is essential for keeping muscles and joints healthy. Set up your workstation correctly. Ensure your chair supports your lower back, your screen is at eye level, and your feet are flat on the floor. Proper ergonomics reduce strain and improve posture. When lifting heavy objects, always bend at the knees and lift with your legs, not your back. Manage stress through relaxation techniques like yoga, deep breathing, or meditation. A calm mind means relaxed muscles, reducing tension in your back. But what if the pain has already set in? Now, here are steps you can take to manage it and find relief. Use heat or ice packs to reduce inflammation and ease muscle tension. Ice works best in the first 48 hours after an injury, while heat helps relax muscles later on. Consult a physical therapist for specific exercises that can relieve pain, strengthen the muscles, and improve your posture. A personalized plan can speed up recovery and prevent future issues. Even with lower back pain, it's important to stay active. Gentle exercises like walking, swimming, or yoga can keep muscles engaged without overstraining the back. If the pain persists, it may be time to consult a doctor. They can help diagnose any underlying issues and suggest treatments such as medications, injections, or other therapies. Maintaining a healthy weight through balanced nutrition can significantly reduce stress on your back. Foods rich in calcium and vitamin D support bone health, while anti-inflammatory foods like fruits, vegetables, and omega-3 fatty acids can help manage pain. So here's a key takeaway. Our lower back supports us in everything we do, from work to play to rest. Taking care of it should be a priority and not just an afterthought. Remember, your back is your foundation. Take care of it and it will take care of you. Remember, manage your lifestyle and make sure your life is not compromised because of your style.